This segment is sponsored by VCU Health Pauley Heart Center.
The doctor is in and you have questions. Today we're joined by Dr. Bhardwaj. She's the Director of Cardiology Inpatient Services, the Director of Echocardiography, and Director of Cardiology Quality Improvement and Safety at VCU Pauley Heart Center. She's here to discuss battling the current surge and the rollout of COVID-19 vaccines, plus special considerations for those with pre-existing conditions, including heart disease. Dr. Bhardwaj, it's wonderful to see you.
Thank you for having me. Wonderful to see you.
There are so many questions, and I'm so thrilled to talk with you specifically about this impact of that pre-existing condition as it correlates to the COVID-19 vaccine rollout.
You know, first of all, heart health is very important. Heart disease is a leading cause of death in the United States. So now with COVID-19, it's even more important. What we found is COVID-19 poses a greater risk to those patients or people who have underlying conditions, including heart disease. There's a lot of research out there that shows that people with coronary artery disease or heart failure have a higher risk of developing a more severe case of COVID-19 or even dying compared to healthy people.
We are learning and responding as we go, with February being Heart Month. It's especially important to put this into focus. But of course, individuals living with heart disease experience this every day, not just during the month of February. Doctor, what can individuals who already have that pre-existing condition like heart disease do? How should they be prepared?
That's an excellent question. The key things are to keep in touch with your physician. With COVID-19 happening, there are a lot of telehealth visits, which are really excellent, safe ways to keep in contact with your doctors. That's important. Keep taking your medications. Don't change anything without talking to your doctor first. I think the biggest thing we've seen are folks who are having symptoms, chest pain, shortness of breath, they don't feel well, might be hesitant to call 911 or come to the hospital. Hospitals are safe. If you're having symptoms, call 911, seek help. Those are very key points. And then the other thing is, if you have any studies ordered for your heart, a heart ultrasound or a stress test, keep those appointments. Again, hospitals, clinics are safe.
That's really critical advice, doctor, because we have heard that along this journey that so many of us put off those routine appointments or checkups, waiting things out. And if you haven't been monitored, if you haven't been doing those, that balloons a potential issue. If you are just general public, or even if you have a pre-existing condition, we want to remind everybody, what are the ways that you recommend reducing the odds of getting COVID-19?
Well, I'm going to emphasize everything I think everyone has heard of, but it's very important. Wear your mask, wash your hands, distance yourself. So we all talk about physical distancing, social distancing, that's key, and wait to gather. Don't be in large groups, wait to gather. And then when the vaccine is available to you, take it.
I think those key important steps we have heard so often, but I had someone remind me the other day to share the correct way to wear a mask.
Correct.
That we are covering the nose and the mouth. It's not down here and it's not here. So wearing those masks correctly is key. What are you recommending that your patients do with getting vaccinated? It's right now, unfortunately, a hurry up and wait, but it's on the horizon.
It really is. When the vaccine is available to you and you're eligible for it, I would recommend having the vaccine. Myself, I've had the vaccine as well. I think together with all the things I discussed, washing your hands, wearing your mask, staying socially distanced, with all that plus the vaccine, we can slow the spread of COVID.
And doctor, I think it is really important, and this really just illuminated for me that if you've been on this journey and you are working with a pre-existing condition and perhaps with a specialist doctor that you typically would see routinely, start this conversation, right? If you have not seen that doctor, make sure that this conversation continues.
Definitely. That's very important. Very important.
Thank you for making time being with us. We appreciate it.
Thank you.
For more information about VCU Health Pauley Heart Center, visit vcuhealth.org/heart. You can give the team a call at 804-628-4327. Find them on Facebook and Twitter at VCU Health Heart. Stay with us. There's still more Virginia This Morning after this short break.